Therapeutic Endoscopic Ultrasound, European Society of Gastrointestinal Endoscopy, ESGE, Technical Review. Introduction. Endoscopic ultrasound, EUS, enables several therapeutic interventions in the pancreaticobiliary and gastrointestinal GI tract. A recent European Society of Gastrointestinal Endoscopy, ESGE, Guideline on Therapeutic EUS provided an extensive overview of the indications and outcomes of these procedures. EUS-guided management of fluid collections in acute necrotizing pancreatitis has been discussed in a previous ESGE guideline. This review of the technical aspects of therapeutic EUS was commissioned by the ESGE to complement the guideline focusing on procedural features and management of adverse events, AEs. Main recommendations. ESGE recommends a prolonged course of a prophylactic broad-spectrum antibiotic in patients with ascites who are undergoing therapeutic endoscopic ultrasound, EUS, procedures. Strong recommendation, low-quality evidence. ESGE recommends placement of partially or fully covered self-expandable metal stents during EUS-guided hepaticogastrostomy for biliary drainage in malignant disease. Strong recommendation, moderate quality evidence. ESGE recommends EUS-guided pancreatic duct (PD) drainage should only be performed in high-volume expert centers owing to the complexity of this technique and the high risk of adverse events. Strong recommendation, low-quality evidence. ESGE recommends a stepwise approach to EUS-guided PD drainage in patients with favorable anatomy, starting with rendezvous-assisted endoscopic retrograde pancreatography, RV-ERP, followed by antegrade or transmural drainage only when RV-ERP fails or is not feasible. Strong recommendation, low-quality evidence. ESGE suggests performing transduodenal EUS-guided gallbladder drainage with a lumen-opposing metal stent, LAMS, rather than using the transgastric route, as this may reduce the risk of stent dysfunction. Weak recommendation, low-quality evidence. ESGE recommends using saline installation for small bowel distension during EUS-guided gastroenterostomy. Strong recommendation, low-quality evidence. ESGE recommends the use of saline installation with a 19-gauge needle and an electrocautery-enhanced LAMS for EUS-directed transgastric endoscopic retrograde cholangiopancreatography, EDGE, procedures. Strong recommendation, low-quality evidence. ESGE recommends the use of 15 or 20 mm LAMSs for EDGE with a preference for 20 mm LAMSs when considering a same-session ERCP. Strong recommendation, low-quality evidence.